Hey, if you've been having back pain, I want to go over with you one of the tests that we do here in the office to determine a little bit of what's going on. My name is Dr. Gregg Gerstin, and I'm a chiropractor in Northbrook, Illinois. I've been helping people to remove the obstacles from their health so that they could lead amazing, fantastic lives for the last 20 years. And one of the things that commonly comes in is people come in with back pain. Now, back pain can be stemmed from so many different things that it's hard to specify. But when our patients go through our three-dimensional biostructural analysis to figure out what's causing the problem, how it's affecting it, we can get precise in knowing exactly what's wrong, what needs to be done, if we can help. One of the things you can do at home that's part of that is assess what's called a Valsalva maneuver. So a Valsalva maneuver is an orthopedic test that's designed to identify if there's something called a space-occupying lesion. Now that's really doctor's term that you don't need to know about, but very commonly it can be associated with things like a disc injury, and it's important to use as a differential in figuring out how do you treat things. Now, here in our office, we have outstanding protocols for treating those, and maybe I'll do another video on that, but in terms of understanding the outcomes of it or what the Valsalva maneuver is, it's where we look to bear down or create pressure in our abdomen. And some of the common things you do in your day that can cause that to happen wind up being laughing, sneezing, coughing, or going to the bathroom and doing a number two, right? If you don't remember what number twos are, I've got little kids, I got a 6 and a 9-year-old. We're kind of getting out of the stages of talking about ones and twos, but if you go to the bathroom to go poo and you wind up bearing down, that increases the interabdominal pressure. And if that winds up causing you to have pain in the lower back, then there's a high likelihood that there may be a disc injury occurring and you should be evaluated for that. The best person to wind up evaluating you for that is a corrective chiropractor. If you know of one, awesome, make sure to get into them. If you don't know of one, write down in the comments below and we'll look to find someone to get you the help that you wind up needing. Once again, my name is Dr. Gregg Gerstin, and thank you for letting me be a part of your health.